Right, today is June 10th, 2014. We're here with Nancy. Nancy came all the way to see us. She has intractable left buttock pain from a motor vehicle accident. Nancy, when was the motor vehicle accident?
April 7th, 2011.
And you've been basically incapacitated since then, is that correct?
For the most part, yes.
You've been in intractable pain, you've been on fentanyl patch, correct?
Right.
And you're also taking 7 Vicodin a day, is that correct?
Yeah, 6 to 7 a day.
Right, and I'm videoing you laying down right now because you told me that you can't stand, sit, or be upright, is that correct?
For the most part, yeah, without pain, and I haven't taken my pain medicine today, so
Okay.
that's why it's worse.
Can I see you get up off of there and walk to the door and see how you function, please? Okay. And if I ask you to stop and bend over, are you able to do that? Can you move, bend over,
Well, I
or
can bend
twist?
over a little, but, you know.
How far can you go?
Well, like that.
Okay. Can you twist your body to the right or left, like turn?
I probably can, but it's, you know, gonna
Very
hurt.
difficult. Okay. All right. And sitting is just as bad. Can I see you sit in the chair and then get back up?
Sure. And I'm not, I gotta sit on the right.
Understood. Okay, you can get back up now and get on the table because I know how much pain you're in.
You're one of the few people that gets it.
Okay. You should notice that she's laying there in pain with her left leg bent because she can't put it down. It will cause excessive pain. Is that correct?
Right, unless I have a heating pad or a pain medicine.
Okay. Okay, you just asked me a question about Procaine, and for the viewer, what I did was I just put about 3 to 4/10 of a cc of 1% Procaine around tooth number 19. And I'd like to see if you can put your legs down.
It still hurts.
Still hurts?
Oh,
Okay.
yeah.
Can you get off the table?
Well, I can, yeah.
Still the same pain? No different?
Oh.
Is there any difference in your pain?
I don't, I feel a little dizzy. Maybe a tiny bit. It's hard to tell.
Okay, that's
It's hard
fine.
to
It's
tell.
not enough. That's fine.
It's hard to tell.
Today's June 19th. We're back with Nancy, June 19th, 2014. We're almost December solstice. Nancy came to us last week in horrible lower back pain, actually, sacroiliac type pain. We've done a number of treatments on her. When she came to see us, she was taking a large number of Vicodin in a day. And her goal was just to get her life back and try to get off of the drugs. And you've had 3 sessions with me now, correct?
Correct.
And you want to
Yes.
tell the viewer what's happened to you? You had a big smile on your face a moment ago.
Yesterday, I took the least amount of Vicodin I've taken, I don't even remember when, because the treatments I did yesterday with a combination of the Prolozone from the day before seemed to alleviate the pain substantially. And it was hard to believe that I've been missing out on what it feels like to be pain-free to that degree. And it's not 100%, but it's so much better than it was when I came in. I am very grateful.
I'm grateful too, believe me,
Yeah.
I am. You said to me that last night you felt for the first time, you said, oh my God, this is what it's like not to have pain.
Right.
And that's
Yeah.
something you hadn't noticed.
Right.
In
I mean, I had pain relief from the pain medicine, but then it comes back.
Yeah, I know, we're not talking
Right.
about pain relief from the pain medicine.
Right.
And also the pain medicine, does it cloud your brain?
It does, but I kind of get used to it. It does. I mean,
Okay.
I don't like being on it, obviously, but
The problem, I guess, for you is you take the pain pill, the pain gets better, but then it's coming back.
right, it
And
comes
now-
back.
And now it's not.
Well, it didn't last night. I mean, I had some pain, but I was able to just get through with using the DMSO, and then I used the PEMF machine before that, so I didn't have to take any more.
Right.
And so that's progress. That's huge progress.
She also is making a comment. I'm sitting.
Right.
Let's look at her. She's sitting very comfortably. I want to make a comment. When you first came to me, you weren't even in this room here.
No, I had to get on the.
You had to lay down on the table because you couldn't sit.
Right.
There was no position that was comfortable for you, right?
No, I was outside leaning up against a wall and leaning up against a car. I was just in a lot of pain.
And for the viewer, what I've done with you is I've done therapy localization, meaning I'm localizing by my techniques exactly where to put the ozone in your back.
Right.
And that, I believe, at least in my hands, for me, it makes the treatment much more precise, and I get better results.
Absolutely, because I've had prolotherapy, and this is very different from prolotherapy.
Tell the viewer what you've noticed between prolotherapy and this, in terms of comfort, needles, discomfort, etc.
Right. Prolotherapy was hell, and extremely painful. Prolozone isn't anywhere near as painful as prolotherapy. And I'm getting results with Prolozone that I did not get with prolotherapy. Plus, I had an allergic reaction to the solution of the prolotherapy, so I think that caused scarring in the ligaments. Okay.
I used to do prolotherapy, and I thought I was very good at it. My patients thought I was very good at it. And, a good prolotherapist gets very good with needles, because that's what we do.
Right.
But it's very uncomfortable for patients because it's a lot of needles, lots. And you're putting solution in, and you could have a problem with the solution. Yeah. And then you get worse over the next day before you get better.
Right.
You get dramatically worse because there's inflammation.
Right.
It's sort of like a backfire to control a forest fire. What prolotherapy does is it's a controlled scar in the area to build up connective tissue to stabilize joints. And how does it do that? The inflammation it creates brings in a blood supply, and then the blood supply can repair. Well, what is a blood supply? It's oxygen.
Right.
What am I doing?
You're putting in oxygen.
Putting oxygen.
Right.
Plus a catalytic oxygen called ozone.
And then it spreads to all the ligaments and takes oxygen to all the cells in the damaged ligaments.
Yes, and that can stimulate repair.
Right. So you can do it with one injection versus 20.
20 in a particular site.
Right. Yeah. Right.
Now, you told me that you have a little bit of pain right now, but it's tolerable.
Right.
And you took no Vicodin today.
Correct. I have not taken any Vicodin today.
And you took none yesterday evening.
Right.
Okay. So, if anything, we would expect you, even though this is appropriate use of Vicodin, very appropriate, to be in maybe some withdrawal and be uncomfortable simply because you haven't had a pain reliever, correct?
Right.
And you're doing well, except for maybe...
And I'm a little clammy, but...
But that could simply be the fact that you didn't
take the Vicodin, right.
Exactly.
Right.
I'm really happy.
Yeah, me too. Me too.